Más claramente la pregunta
Medical
sería,
Spanish is helping School of Medicine students overcome language and cultural barriers to become more effective physicians.
para un músculo así como que adolorido.
Students learn specific terminology in Spanish and learn how to communicate with Spanish-speaking patients.
Hola, Erika.
The elective course for first and second year students is led by Dr. Sandra Quezada, who was an English-Spanish medical interpreter before entering medical school herself.
I have a really deep appreciation for how important language is in being able, both for the physician to be able to really make a proper assessment and come to the correct diagnosis, communicate treatment, etc., but also for the patient to be able to express themselves, to raise their concerns, ask the right questions.
Students believe the medical Spanish course will make them better doctors.
Being able to speak Spanish will enable me to understand my patients much better, much more clearly, to know exactly what's hurting them or what their complaints are, instead of going through a family member who maybe knows a little bit of English but maybe not so much. Being able to be there and actually speak the language directly with the patient will be very helpful for both parties.
Okay, and so now you're going to ask your patient, since you've had a fever.
Dr. Quezada says understanding cultural differences is key.
In the Latino culture in general, physicians are actually put on much more of a pedestal, you would say, than maybe in American culture. And so there's more of a distance that can create. And sometimes maybe the patient may be less forthcoming with some of their concerns or complaints, et cetera. So having that understanding and not taking at face value that if your patient just says, I'm fine, everything's fine, that you may want to dig a little bit deeper.
Not all medical schools have a physician like Dr. Quezada teaching Spanish.
Having Spanish as a physician or future physician is a very important skill to have if we want to properly connect with our patients.
Mantenerlo bastante controlado y localizado en alguna parte del cuerpo.
For the University of Maryland School of Medicine, I'm Larry Roberts.
The next two are easy. Bacteria, bacteria, y virus. How about fungus? Yes. Hongo. Very good.